Hello, good afternoon to everyone and welcome back to the channel The Upcoming Doctors. So in this session we are going to discuss about the language of anatomy, and this will be coming under the two sessions, okay, part 1 and part 2. So this is the part 1. In this part 1 we can discuss about positions, planes, movements and terms. So let us get started into the topic. So we have different positions, okay. The anatomical position, main positions are four positions: the anatomical position, supine position, prone position, lithotomy position. And coming to the anatomical position, when a person is standing, eyes looking forwards, okay, both arms are present by the side of the body. I'll show diagrams also. First we can see this matter of four positions, and coming to the diagrams also we can see palms facing forwards and feet are together. This kind of position is called anatomical position. And coming to the supine position, otherwise called supination, okay. Remember this, the supine position is otherwise called supination. So when a person is lying on her or his back, okay, arms by side and palm facing upwards, the palm will be facing upwards and the feet put together. This conditions if satisfied, this is called a supination position. And coming to the prone position, this is otherwise called pronation, okay. Pronation, in this what will happen, the person will lie on his or her face, chest and abdomen. Remember this point, he will be like lying on his or her face, chest and abdomen. And coming to the lithotomy position, person will be lying on her back with legs up and supported in the straps, okay. The position is mostly used during the delivery of the baby. So this is the position which can be used during, mostly it is used during the delivery of the baby. And coming to the diagrams, we can see what are these positions of the body, right. Here in this diagram we can see this is called anatomical position of the body. So we already discussed, the man is facing, okay, he is looking forwards, okay, eyes are looking forwards, and the palms on either side of the body, the arms are present and palms facing forwards, okay, these are also facing forwards and feet put together. This position is called anatomical position. And coming to the supination, other positions, yes, here we can see the other positions. First one is the supination, okay. The person lying on her back and arms are present either side of the body and feet put together. This condition is called the supination position. And coming to the prone position, otherwise the pronation, here we can see the person lying on on his face, chest and abdomen. So this is this position is called pronation. You can remember by this mnemonic like P and P, okay. P for pronation and like promise. We can promise, no, like the palms are facing downwards, and in the supine position the palms are facing upwards, okay. Palms are facing upwards, and the pronation position, like just like promise, we are doing promise, so the palm will be facing downwards. This can be remembered by this like P and P, promise and pronation, and supination, the palm will be facing upwards. These are the positions. And coming to the lithotomy position, we can see here the person, she is lying on her back, okay, and like legs are upwards, which are supported with the straps. These are the straps which give the support, and this position is mainly used during the delivery of the baby. These are the four positions of the body normally. You can understand the anatomical position, supination, pronation and the lithotomy position. And coming to the planes, okay, we also have different planes. First topic is completed, that is the positions, and second topic is the planes, okay. We have mid-sagittal plane, coronal plane, parasagittal plane and transverse plane. These all planes are present. And remember this point, this is very important. We are learning, from now we are going to read the gross anatomy. So father of anatomy is Herophilus. Definitely he would be done many contributions to this anatomy, so he is called father of anatomy. So please remember, pay respect to towards the scientist, and remember father of anatomy is the Herophilus, okay. Coming to the our topic, that is planes, we have four planes, that is a mid-sagittal plane, coronal plane, transverse plane and parasagittal plane. Now in detail we can see what are all these planes, okay. So first plane is the mid-sagittal plane. It is otherwise called median plane, okay. Mid-sagittal plane or sagittal plane, otherwise the median plane. If the body is present like this middle plane is called the mid-sagittal plane. We can first of all see in the matter, I will show diagrams for each and every one. And a plane which is passing through the center of the body, dividing, which means a line, okay, line or the plane which is passing through the center of the body, dividing it into two equal right and left halves. Definitely if you are dividing the body into two halves, there will be right half and left half. So this plane is called, which is passing through the center of the body, it is called mid-sagittal plane, otherwise called sagittal plane, also called as median plane. Remember one thing always, median, okay? Remember the spelling, n, median, not medial. Medial, both will have different meaning. First of all, this will be the body, no? So I'll explain in another color so that you can understand. This is the median plane, and this is the medial side. Okay, definitely if like this is present, this is the medial. Okay, this will be the medial L, okay, and this will be the lateral L, and this will be the median. Okay, whatever present just near to the middle or the median is called medial. Please remember that this difference. Okay, and coming to the second plane, we can see that is the coronal plane. Okay, the coronal plane, a plane at the right angles to the sagittal plane. The coronal plane will be lying at 90 degree with comparison with the sagittal plane or the mid sagittal plane, which divides the body into the anterior and the posterior halves. We already seen that the mid-sagittal plane will divide the body into the right and left half, whereas compared with this coronal plane, it will be 90 degrees to the mid-sagittal plane, and it will divide the body into the anterior and the posterior halves. Coming to the third plane, that's very important, that the transverse plane, and now it will divide. Transverse means horizontal, no? The word itself says a plane at right angles to both sagittal and the coronal planes. The transverse plane lying 90 degrees to the mid-sagittal plane and the coronal plane. At the same time, it divides the body into the upper and the lower parts. Okay, these are called the different planes of the body. Now we can see in the diagrams the different planes of the body. So this first diagram, we can see the coronal plane. So the coronal plane is dividing the body into which halves? Yes, you are correct. The coronal plane is dividing the body into the anterior half and the posterior half. This is the posterior half and this is the anterior half, which is shown in the different colors. Okay, color shades. So this is called the coronal plane, right? This is the coronal plane, and yes, we can see in the diagram, left right axis key is divided, and also craniocaudal. Cranio means head and caudal means tail. Okay, topmost portion is called the cranium, and caudal portion means regarding the legs. Okay, and this is the coronal plane. And coming to the other plane, yes, this is the transverse plane. You can see it, and the body is divided into the upper half and the lower half in this position. Okay, and this is the mid-sagittal plane. We can also see here the yellow line represents the mid-sagittal plane, and the parasagittal plane means on the either side of the mid-sagittal plane we can find this parasagittal plane. Okay, this is all about the planes. And coming to the other topic, we completed the positions. Okay, positions. What are the positions? The positions are anatomical position, supination, pronation, and lithotomy position. Remember these 4 positions and definitions. And coming to the planes, these are the 4 planes again. Mid-sagittal plane, otherwise called sagittal, also called median plane, N. Okay, and next plane is the transverse plane, and then coronal plane, and the parasagittal plane. Okay, and now we are going to discuss about the movements of the body. What are the movements? Okay, so yes, the movements are mainly, remember this, flexion, extension, adduction and abduction. The flexion is nothing but decreasing the angle. Decrease in angle between the parts, I mean articulating bones, that is called flexion. Remember, flexion means decrease in angle in between the articulating bones. And coming to the extension, definitely it is opposite to the flexion, so increase in the angle between the articulating bones. And adduction, adduction means adding. Okay, remember like this, adduction means add. Okay, adding to the body, which means the movement of the bone towards the midline of the body. Okay, and coming to the abduction, the movement of the bone away from the midline of the body. So flexion, extension, adduction, abduction, these are the 4 movements. The flexion means decrease in the angle in between the articulating bones. Again, extension means increase in the angle between the articulating bones. Articulating bones means the bones which can take part in the joint formation. I already told articulation means just joint. Okay, joint formation. And coming to the adduction and abduction, adduction. So ADD, add, you can remember addition to the body. So movement of the bone toward the midline of the body, away from the body, then it is the abduction. And coming to the movements, we have again in upper limb we have movements, lower limb, neck, trunk, all these are present. So in this part 1 we are going to discuss the upper limb. Okay, upper limb, and in coming session we want to discuss about the lower limb, neck and trunk, and other topic also. So coming to the upper limb will have the flexion when 2 flexor surfaces are brought close to each other. This is called flexion. Example, at the elbow joint, the front of arm will be present, forearm will be present, are opposite with each other. Okay, opposite to each other. This is called as I already discussed to you the parts of the body, right? Arm, upper limb will be present. In upper limb, the arm, forearm will be present, hand will be present. All this is told to you, okay? Otherwise, I'll explain once. Please wait. And yes, here we can see the skeleton of the human body, which is already explained. Right, in this we can see the bony structures. Okay, this is actually the humerus, the part of the part where the humerus is covering. This is called front of the arm. Okay, and definitely back will be back of the arm. So up to this point, up to the elbow joint, in front of whatever the present, that is called the arm. Okay, this portion is called arm. Remember this point. And before the arm, the part which is present up to this ulna and the radius are present. No, this is called forearm. Okay, remember, forearm. And this is called hand. Okay, these are the portions of upper limb. So you need to have the idea. Upper limb bones are humerus, radius and ulna, and then carpal bones which are participating here. Here we can see the carpal bones. So these are the carpal bones are present, and then these are the already discussed, no, carpals, metacarpals, phalanges will be present. So the bones are humerus, radius and ulna, and carpals, metacarpals, phalanges. These are the bones. And coming to the parts where the humerus is present, the flesh is present, no, muscle, everything is present. That is called arm portion. And where the radius and ulna are present, that is called forearm portion, and remaining is the hand portion. This is all about the upper limb. So with this background, we are going to discuss about the movements of the upper limb. We already discussed the flexion. Flexion means two flexor surfaces are brought close to each other. For example, elbow joint, the front of the arm will be present and front of the forearm will be present. Arm means where the humerus bone is present, and the forearm means the bones are radius and the ulna. Radius on the lateral side, ulna on the medial side. This is also important, remember, are opposite to each other. This is called flexion of the upper limb. Okay, and now coming to the other movement, that is the extension of the upper limb. When the extensor surface, flexion means when the flexor surfaces are brought to each other, okay, close to each other, that's called the flexion. And coming to the extension, it means when extensor surfaces are brought in as much approximation as possible, this is called extension. Okay, first of all, remember whatever points I'm saying, I'll show briefly in diagram also. Okay, first of all, listen. Example, the straighten the arm and forearm. You can do this. Straighten the arm and the forearm at the elbow joint. You can straighten the hand. Okay, entire upper limb is straightened. That is called as extension of the forearm. I mean extension of the upper limb. Okay. And coming to the next movements, the abduction, when the limb is taken away from the body. I already told, whenever away from the body, that's called abduction. Okay, B and D, no, both facing opposite. You remember like this. Adduction, addition. So brought close to the body. Remember like this. Addition, adduction. I mean ADD is present, that means addition to the body, brought close to the body. Okay, abduction means B and D are present, no, away from the body. Okay, away from each other, so away from the body. Like this you can remember. And coming to the circumduction, it is a movement of distal end of the part of the body. Again, I already said you what is the proximal end and what is the distal end of the body. So a combination of extension, abduction, flexion, adduction. You should remember in this sequence only. In a sequence, whenever followed, the extension, abduction. Extension means just straightening the upper limb. Abduction means away from the body. Just take away from the midline of the body. And flexion means again you can flex the flexor surfaces, like decreasing the angle between the front of the arm and the front of the forearm. Okay, just flex the upper limb. And then adduction. Adduction means bringing towards the midline of the body. All this whenever occurs, right, in a sequence as seen, this is called, for example, as seen in the bowling, right, this combination is called as circumduction. And coming to the abduction of the fingers, when all fingers will separate from each other, no, like we are making like this, and that is called abduction of the fingers. And coming to the adduction of fingers, when all fingers get together, no, that is called adduction of the fingers. And apposition of the thumb. Apposition of the thumb means whenever the tip of the thumb touches the tips of any of the other fingers, that is called the abduction. Okay, and medial rotation, when the arm rotates medially and bringing the flexed forearm across the chest. You do this, the arm rotates medially. Medially means like towards the body, and bringing the flexed forearm across the chest. That is called medial rotation. And coming to the lateral rotation, when the arm rotates laterally away from the body, taking the flexed forearm away from the body. I already told you, laterally means almost away from the body. That is called as lateral rotation. So we can see this in the pictures, right? We can see, 1 minute. I'll show in the pictures. So these all are the pictures we can see here. This is nothing but the First, second picture we can see the flexion. This is the angle. Okay, this is the arm portion, this is the arm, right, and this is the forearm portion. So decreasing the angle in between the flexion and arm and the forearm, this is called the flexion. Okay, I'll discuss this in the next part. So this is all about the language of the anatomy part 1. So stay tuned for the next part. Thank you so much for your support. Like, share and subscribe this channel. Thank you.